Hello and welcome to my channel on health education. I'll be looking at cervical cancer, a video meant for the awareness of the cancer. The Bible gives us a proverb in Proverbs chapter 22 verse 3, and the same is repeated in chapter 27 verse 12, that a prudent man foresees danger and takes precautions. So, but a simple person goes blindly and will suffer the consequences. So, in this video, it's aimed at giving us knowledge regarding this condition, this cancer, so that you have the ability to foresee the danger, and then protect yourself and take precautions. So, cervical cancer is a cancer that primarily affects women because they are the owners of the cervix, and it starts from the cervix. The cervix is the gate into the into the womb, into the womb. So it's right here, and that's where the cancer starts. This is an image that portrays how it will grow. It can also grow downwards. It can grow sideways like that. And for better orientation, basic biology will tell us that the uterus is deep in the pelvis down, and then the cervix separates now the uterus and the birth canal. So the birth canal is a part that is visualized outside. Uh, okay, the canal definitely is not all of it visualized outside, but we are aware of that. But many of us are not so aware about that gate. Now, this is where it affects. And if the doctor looks through the birth canal, this is how the cervix will appear. So the cervix is usually the narrowing of the uterus from above, and then it separates it from the birth canal. That is the cervix. So you have a small opening, and then very thick muscles, tissue here that is now commonly affected by the disease. And on an upright image, this is how it would appear. So we've said that it is a malignancy, so-called cancer. Malignancy is the other name for a cancer because it has the ability to spread. So it arises from the gate of the uterus, the cervix, gate of the uterus. So this is again another image looking into the uterus, into the birth canal and seeing the cervix. So it affects women from the age of 21 years and above commonly, and it's the leading cancer affecting women. It's a leading cancer affecting women, especially in the genital area. The breast cancer is the leading in women, but cervical cancer and talking about this cancer in Kajiado, it's the most prevalent than even breast cancer in Kajiado. So cervical cancer is a leading genital cancer in women. We have other genital cancers, cancer of the uterus itself, originating from the endometrium or rather inside the uterus. We have another cancer that could originate from the ovaries. Remember, the ovaries are usually located here, like we saw in the previous image. We have cancers from the birth canal. We have cancers from the vulva down. But this cancer originating from here is the main and the most common cancer affecting women genitalias. Genital area. So it's caused primarily by a virus. So this is one of the cancers that an infective process has been associated with, and the virus called HPV is a cancer that has primarily been associated with cancer. Around 99.7%, almost 100% of patients having cervical cancer have had this HPV infection. Around 0.3, very few patients with cervical cancer have not had HPV infection. So this virus has been associated with the cause. The virus, however, affects almost half of the populations. people, everyone who have been sexually active has been exposed to this virus. Uh, but it's not routinely tested because uh, the virus is not so contagious. It only causes cancer in around 10% of the women that it infects, and around 70 to 80% of people who have had exposure to this virus have always defeated the virus and cleared the virus from the body. So those are the reasons why it's not really being tested. It's also a very expensive process, and most labs do not offer the the tests for HPV virus. And also, even if you are tested and you are positive, there is usually no treatment for being positive for HPV. You would only be advised to be cautious and have surveillance for cervical cancer. This virus would affect what we call a transformation zone of the cervix. Transformation zone is an area inside. Look at this image. Is an area in the cervix where the lining of the inside of the cervix and the lining of the outside of the cervix separate. So this area here, so you see the change of the color. So red is towards now the uterus, going inside the uterus, and then the pink outside is usually coming towards the birth canal and lines the birth canal. But then now the area between them is called the transformation zone because there's a change of the cells that are covering this area, and the area is also dynamic. It moves in and outwards based on many factors, giving birth, hormone issues, and age as well. So this area moves in and outwards, and in all those factors that we talked about, it is so susceptible and easily can be affected by this virus. So what are the risk factors? Number one is when you have the HPV virus. So if you have the HPV virus, you have a high tendency of developing, a high likelihood of developing the cancer. If you have HPV co-infection, like you have HPV along with HIV, sorry, along with HPV. So human papilloma virus along with the HIV, then that one commonly would increase chances of one developing the cancer than a woman who only has HPV. Now, if one has multiple sexual partners, they also increase chances of developing the cancer because um, remember we said the virus is usually cleared by the immunity of the body. But then again, if you get reinfected, clears, then you could develop now a prolonged infection of HPV, which now can give us the development of the cancer. Now, if one also has many births, they tend to have a likelihood. I've already alluded that when one has this zone coming outwards, I think I have another image. When this white zone here, this white zone here, if it comes outward, then it has a chance of being infected by the HPV, and the cells here are usually very susceptible for HPV infection. So many births will tend to push the transformation zone outwards. But that's not to say if you have many children, you're definitely going to develop the virus. But we are saying many of these things together would increase the likelihood of one developing the cancer. Now, if one also has had an early sexual debut, having sexual intercourse before the age of 16, also one is predisposed to developing the cancer. And also, poor socioeconomic status has been associated with this cancer, primarily because people tend to delay seeking health care, and the cancer usually complications are noted more in this population. But you don't get a cancer because you're poor, but now the complications tend to hit more in the society where people are not able to seek health care. What are the stages of this cancer? The stages of this cancer are are an important thing or important understanding to have, because the earlier the stage, the better the likelihood of management or treatment. So this cancer can primarily be in the cervix, and when this cancer is primarily in the cervix, then it is easier for the doctor to advise you accordingly. Remember, most of the cancers are usually treated surgically by removal of the origin of the cancer. So if the cancer is still primarily located in the cervix and it has not moved out of the cervix, then a surgical procedure can easily cure you completely from that cancer. But if it starts moving out, sorry, if it starts moving out, you can, let's say along the birth canal or even across, that's now stage two, and then it can get to stage three. Stage three is when now it has gotten into the pelvic bone. So stage three is when you've reached the pelvic bone. So these are the pelvic bones. So if it reaches the pelvic bone, definitely it will have started to have several other complications, and you cannot have a surgery to remove everything from the pelvis, definitely. So when it gets there, then normally it's not very easy to manage it by surgery. And you see, as it is moving towards the pelvic bone, it encounters along a very good pipe called the ureter. The ureter brings down urine from the kidney down to the bladder that will be located in front here. So that ureter is blocked. That ureter is blocked, and then with that ureter blocked, the urine will go back to the kidney, and the kidney is injured. I think I'll have another image for that. Now, stage 4 is now an advanced cancer which has moved out of the pelvis, and you have the cancer in the chest or in the lungs, in the liver. Yes, quite an advanced. What are the symptoms? So, unfortunately, in early stages, the cancer is not symptomatic. Please, we need to note that. In early stages, it's not symptomatic. So, what we do, we just have to take precautions. We just have to get screened. That is the only way we can foresee this danger. Otherwise, the cancer in early stages cannot be felt by the patient. So, but as it progresses, you can have vaginal bleeding where you have okay, sorry, but you can still see this is an actual photo where you have the tumor here, and then you see how it's bleeding so much, and one is losing a lot of blood. You can also have bleeding that comes after one has had intercourse. So as soon as you have intercourse, you feel like there's always some bleeding after that. Why? Because if there is such a growth in the cervix, it has a tendency of bleeding once it is tampered with. Now, you can also have pain during intercourse. Not very common, but you can have pain during intercourse. You can also have a discharge from the birth canal, because usually this growth tends to have infections, and then now you'll develop an offensive or a foul smelly discharge. Sometimes it can even be pus. Yes, but when the cancer advances and it crosses the pelvis, you can see from this other image. This will be the uterus. Let me change the color. This will be the uterus. So this is the uterus here. This is the uterus here. This is the urinary bladder. This is the rectum, the place that contains the stool before one passes stool. But now, if the cancer advances, all these organs can start giving us pain, a lot of pain in the pelvis, and then difficulty urinating. We've already said that the cancer can block the urine that's coming down from the kidney. And also, as the cancer advances, one develops just general weakness. Of course, you've lost a lot of blood. The cancer is also taking a lot of your energy, and then you just become generally weak. And then other organs, like the cancer gets to the liver, you have issues from the liver. The cancer gets to the lungs, you have issues breathing, and all those things become very complicated. This is another image that was depicting how the cancer blocks the ureter, blocks the ureter. It can block both of them. It can block one, and the kidneys are always damaged. The kidneys are damaged when the urine gets back to the kidney. When the urine gets back to the kidney following the blockage, then the kidneys are damaged. Now, this is the same. This is an image also depicting how the cancer spreads. It can spread through blood. It can spread through what we call lymphatic vessels. Lymphatic vessels are just small, tiny pipe-like structures that drain excess water. So now, from the cervix, those pipes can also take the cancer to lymph nodes around the area. Now, what are the complications that can arise from the cancer? Complications are things that the body starts suffering from, primarily originating from the cancer. Anemia. Anemia is losing a lot of blood. So you've lost a lot of blood, and then you just have anemia. And then kidneys are damaged. We have already alluded to that. Your kidneys are injured, and this is usually the commonest cause of death in advanced cervical cancer. Because when you come, kidneys are already gone, then you need to be dialyzed, you need to be transfused. Then the process becomes very complex, and it becomes very difficult to manage a very advanced cancer. Fistula is a connection between two areas. In this image here, this is the cervix, this is the pathway for the stool, and this is the urine area, and this will be the bladder canal. But now if the cancer grows from here, it can spread to the urinary bladder, it can spread to the rectum, and then a connection develops between the rectum and the birth canal, or from the urinary bladder to the birth canal. So if that connection develops, it's a very difficult thing to manage as well. So, and then like I already said, infections. So you get a lot of infections because you have tissues, you have blood here, and then that encourages bacteria to grow. Then metastatic sites. If you have an infection that has, I mean, the cancer that has gone to an area like the lungs, you have problems. So you now have primarily the cervical cancer, but now you also need uh, care for the chest, or care for the liver, or care for the kidneys. So now the cancer has given us all those other complications. How do we prevent this? So we prevent this by, there's a HPV vaccine. So fortunately, the virus can be vaccinated against. We don't have cure for the virus, but one can have a vaccine for HPV. So this vaccine is usually preferred for young young girls, although boys can also be given because men are the carriers of the virus. Men will carry the virus, and like we already said, sexually transmitted. So men can also be given the vaccine. But due to resource constraints, we get the vaccine to the girls aged 9 years to 15 years, and usually that is a dose of is the vaccine of 2 doses. One can also get at a later age, and then they may have to get three doses of the vaccine. You'll be advised accordingly when you go for the vaccine, and please go for one and take your girls for this vaccine. Now, the best way to prevent this also is just a continuous surveillance, watchful. We wait, we look for it until we see, or if we don't see, then you're good to go. So by what we call a pap smear and via villi. You'll also be told about the screening tests. Please, when you visit a qualified healthcare professional. Now, HPV test is also available, but not in many labs. But you can take it, you can have it, and then if you have a HPV test and you are a negative, then usually that lowers down the likelihood of developing the cancer, and you can do a pap smear once in 5 years, or just relax, because you have a very low likelihood of developing the cancer if you don't have the HPV virus. Now, so diagnosis, like I said, HPV, I'm sorry, a pap smear would lead, or any doctor's examination can lead. If a doctor examines the birth canal and the cervix and sees any suspicious mass, then that will now result into what we call a biopsy. So they will take a small pinch of it, a small pinch from the cervix. The cervix is here again. So the doctor will take a small pinch of it. I think this is depicted in this picture. You take a small pinch of it, and then that is sent again to a pathologist to tell us if it is indeed a cancer, or some of them, several other growths that can grow from there. And imaging is then done. And imaging can be a CT scan or an ultrasound to look into the area around the uterus and the cervix to see if the cancer has spread. Now, how it is treated? I said the best treatment will be surgery. This is only possible if the cancer is in stage 1. Cervical cancer is a very weird one because past stage 1, past some stage 2, these things are given some stagings again. Then usually it becomes very difficult to do surgery because it could have already crossed the walls of the birth canal, and it's not usually advisable to do surgery if you do surgery and you've left behind something else. So the best place to get it is early as possible when it is still primarily in the cervix only. Now, if you don't get that at that point, then you would have to undergo what you call radiation and chemotherapy. So radiation is an exposure to intense radiation rays, which will try to kill the cancer cells. Like in this one, this is a modality that is even used to take the radiation very close to the origin of the cells to try and kill them. So what is this pap smear? So this pap smear is it's a procedure that is very saves lives because it depicts this cancer very early. Now, for orientation again, you see that the cervix is very far from the vulva or from the outside, and you can't have it. You can't just see it, and even yourself, you can't even feel what is going on there as a woman until a doctor examines. How do they examine? They will look into the cervix. They will put one in this position. It's called alisotomy position. Then you introduce this instrument called a speculum. Then now you see the cervix. If you see the cervix through, then you are able to examine. And then if you are not examining, or if there is no mass, an obvious mass, then you do a pap smear. So a pap smear is a brush is introduced. So this is the speculum, and then a small brush is introduced through the speculum, and then it wraps around the cervix to pick some cells, and then these cells are now sent to a pathologist again to examine what it has. And then if they say it's clean, there is no cancer, you are good to go, and you can do that after another 2 to 3 years. So this is encouraged for women 21 years and above, from 21 years and above up to 65 years. And if they have not had any pap smear results that are suspicious for cancer at this age, they can stop having the pap smear after that. So, and if a woman is HIV positive, then they are encouraged to do the pap smear every year. Every year. Again, our Bible verse encourages us to be very watchful and foresee danger. This is the best procedure that can be done on you regularly to foresee this danger. If you don't do this procedure, you will present with a big mass, you will present with anemia, you will present with kidney failure, and usually options of management are very minimal at that point. So again, it's a warning that cervical cancer is very silent and has no symptoms in early stages. So screening is advised, and that is a pap smear or VIV line based on the resource availability and the regions. So any abnormal bleeding, unusual discharges, and deep pelvic vein, please see a doctor who may advise that you have a pap smear straight away, or who will examine the cervix. And seek medical attention immediately. So thank you so much, and that's all about the cervical cancer awareness. I hope at this point we have so much knowledge of how bad this disease can be and how it is good to be watchful and look into our health so that we are able to pick these conditions early on time and please God by obeying His word, by not being fools, and being wise people to to take precautions and just have ourselves checked regularly so that we are able to take precaution. You better not have a cervix than have a kidney failure and very expensive processes afterwards. Next video will be on prostate cancer, also an awareness video on prostate cancer, cancer that affects men primarily. Okay, men are the only humans with also prostate, and we'll look into that also because the prevalence has also been noted to be very high. Thank you so much, and see you during the next video.